guys, and welcome to Shalom Aleichem. So today we will be talking about exposure and response prevention therapy, what exactly it is, and why it is a good way to treat OCD and other anxiety disorders. I talk about that a lot on my channel, however I've never really done like a video that gave a definition of it and really like sat down and talked about it, so I'm going to talk about it today. Although for the rest of the video I'm going to be calling it ERP because exposure and response prevention is kind of a mouthful. I'd rather not be repeating that too many hundred times and messing up on it like every single time. So let's get started. ERP actually explains a lot in its name. Exposure and response prevention therapy. So it is exposure, you expose yourself to the things that scare you. Response prevention, you don't respond the normal way you would that would usually decrease anxiety. And it's a therapy. So that's basically the definition of it. It's you expose yourself to what you're afraid of, and then you don't do the response that would normally decrease your anxiety. For example, when someone exposes themselves to what they fear, this could be in the form of a picture, or a place, or a person, or anything that makes them anxious, pretty much. And then for the response prevention, this is where the patient does not do the act that would decrease their anxiety. So this could be either avoidance or a compulsion when dealing with OCD. For example, if a patient has harm thoughts, they might look at a picture of a knife for an exposure. Now, if they get an image of themselves stabbing someone with that knife, instead of avoiding that image like they usually would or doing a mental compulsion, instead they would focus on the image and they would not avoid it. You may be now thinking, Kat, why would I do something that makes me anxious? And this next paragraph that I took from the OCD Foundation website will explain how exactly, kind of how exactly this works. And yeah, I'm just gonna say the paragraph. When you are facing actual danger, say crossing a street and you see a truck speeding towards you, your brain puts out information that you are in danger by making you feel anxious. The anxiety creates motivation to do something to protect yourself. The behaviors you engage in to protect yourself can actually save your life. For example, getting out of the way of the oncoming truck. Unfortunately, in OCD, your brain tells you that you are in danger a lot, even in situations where you know that there is no danger or there's very little danger. Now consider your compulsive behaviors as your attempts to keep yourself safe when you might be in danger. What are you telling your brain when you try to protect yourself? That you might be in danger. In other words, your compulsive behavior fuels the part of your brain that gives out to many unwarranted danger signals. In order to reduce your anxiety and your obsessions, you have to stop the compulsive behavior. What do you have to risk by not protecting yourself? It feels like you are choosing to put yourself in danger. Exposure and response prevention changes your OCD and changes your brain because you actually find out whether you are in real danger or not. Not to mention, you've probably been doing obsessive and compulsive behaviors your entire life. And have they changed very much? I mean, has doing the compulsive behaviors gotten rid of the obsessions? No, probably not. Your anxiety goes up, you do a compulsion, it goes down, and then it comes right back up as soon as the obsession comes back. As much as you want to avoid the things that makes you anxious your entire life, it's literally impossible. Because the more you avoid it, the more association anxiety you're going to have about it and things around it. For example, first you're afraid of crowds, then you're afraid of going to the mall, then you're afraid of going outside, and then you can't leave your house, and then what fun is that, just staying in your house all the time? On the other hand, when you go into an anxiety-inducing situation and you stay there for a while, eventually your anxiety will go down. It's like when you jump into a cold pool and at first it's like so cold, and then after a while it starts to feel pretty warm and then you don't want to leave. This is called habituation. Also, if you continue to expose yourself to these anxiety-inducing situations, then eventually the initial anxiety will go down as well, until maybe you're not even anxious at all about going into the situation. Therapist Katie Dath has an excellent video on this, which I will put in the description. You may think, how, Kat, can I expose myself to my biggest fear? With ERP, you will work on those fears, but first you will work on smaller fears. With ERP therapy, you will first create a hierarchy of all of your anxieties, which means you will rate them from 1 to 10. When you start doing exposures, you'll start with the anxieties that are rated a 1, and then you'll work up to ones that are 2, 3, 4, 5, and eventually 10s. And as these lesser anxieties get easier to work on, the higher ones will be easier to work on too. This ERP method has been researched and used successfully with patients with OCD and other anxiety disorders. I can also vouch for the effectiveness of ERP therapy because I've done it myself for my OCD and social anxiety. I used to be afraid of ordering things at a restaurant or making small talk with a stranger, but now I can do those things with ease. I originally made my channel because I often see people on YouTube talking about OCD, but they don't talk about how they treat it. They don't talk about effective treatments. Instead, they'll talk about avoidance and stuff like that. And I really want to promote a healthy way to treat OCD that I know works and that I know can work for you. I took a lot of my inspiration for starting this channel from Mark Freeman and Katie Dath, who talk about doing exposures, and I will link to them down below, I think, because they are wonderful people. They have a lot of videos on doing exposures. So yeah, this video really is what I want my channel to be about. Treatment for OCD and treatment for anxiety and treatment, like recovery. Because it's great to spread awareness, it's great to talk about these things, but I also want to talk about how we can treat these disorders and how we can get better, because getting better really is the main goal. If you have any questions on ERP therapy, post it in the comments below and I will happily answer your comments in a video or in a comment response. So thank you guys for watching. Subscribe for more videos on OCD, anxiety, and mental illness in general. And I will see you guys later. Bye! So I thought exposure therapy was the same thing as ERP, but it's kind of not. That's kind of like how I thought HOCD was the same thing as harm OCD. It's not. I'm not a psychologist.